At Blue Shift Medical Licensing, their goal is simple: to have you do as little as possible. Their expert team takes care of the entire licensing process, from handling all of the paperwork to ensuring every detail is perfect. They even track your renewals so you never miss an important deadline. With Blue Shift Medical Licensing, you can relax knowing your licensing is in the hands of a certified professional. Let them do the hard work for you, and mention this podcast, The Mindful Medics, for a 5% discount. Find them at blueshiftlicensing.com. Well, hello and welcome to the Mindful Medics podcast, where we dive into the lives of medical professionals, exploring the triumphs and the trials of their careers, and uncover how mindfulness practices can empower them to thrive both professionally and personally. Join us as we discover the keys to a balanced, fulfilled, and healthy life in the demanding world of medicine. Today, I'm thrilled to introduce Dr. Gail Gazelle, a former hospice physician, part-time Harvard Medical School assistant professor, and a master certified coach for physicians. Over the past decade, she has coached over 700 physicians and physician leaders. She is active in the Harvard Institute of Coaching, where she was a founding member. She is also author of the 2023 book, The Mindful MD: 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. And if all of that weren't enough, Dr. Gazelle has published twice in the New England Journal of Medicine, and her work has been featured in the media in diverse venues, from CNN to the Wall Street Journal, Medical Economics, to the Oprah magazine. So welcome, Dr. Gail Gazelle.
Such a pleasure to be here today.
Fantastic. So I'd love to hear a little bit about your early life and what inspired you to pursue a career in medicine.
Well, that's going back a little ways, Leonora. I grew up in a seemingly highly functional, 2-parent, middle-class family outside of New York City. And unfortunately, like many families, it was not a really intact, functional family. It was a very dysfunctional family where there was a lot of abuse. And I came out of that abuse kind of wanting to help people with their struggles in life. And in fact, because the abuse and dysfunction was very isolating for me, I found myself gravitating toward caring for individuals who were approaching the end of their lives. And I didn't really understand at first why I was so drawn to end-of-life care. I hadn't experienced early deaths or that type of trauma. But I came to see, as I progressed in my career as a hospice and palliative care doc, that it had to do with that concern about people not being isolated. Because you have to remember, you can see from my white hair that this was more than, a couple of decades ago. Palliative care wasn't yet a field. And so we'd go on rounds and you'd go, the attending and the big cluster of trainees, the attending would say, oh, there's a fascinating case of, fulminant pancreatitis, let's go in. And then the next one would be, oh, fascinating case of whatever other fascinoma. And then the next room, oh, no, she's dying. We don't need to go in. There really was this profound isolation, and somewhere in my psyche, I understood that connection. So that's kind of a quick tour of my life, and frankly, the voice and the mission that it really kind of instilled in me.
Yeah, that's beautiful. Thank you. Thank you so much for sharing that with us. Could you share a little bit about the timeline of your career and any kind of challenges that you faced along the way and how you overcame them?
Yeah, so I trained in internal medicine. Palliative care fellowships weren't a thing then. And I began working in a large HMO here in Boston. And I wasn't sure how to get to a career in end-of-life care. So I did a medical ethics fellowship here at Harvard Medical School. And sure enough, when the HMO that I was working in decided to start a palliative care program, they looked around and they thought, well, who can do this? Well, she has experience in medical ethics. So that really launched my career in end-of-life care. I loved my work. It's incredibly sacred, rich work. But I was raising a son on my own. I had a busy academic career, busy clinical career, pressure to publish, et cetera. And I struggled with burnout.
Yeah.
Really feeling like I was never good enough in my career, never good enough as a mom, never good enough as an academician. And that really fueled a lot of burnout. And at the same time, I had a lot of self-criticism, which I think my training, if I hadn't had it before, kind of bolstered, that self-critical lens. So I struggled with burnout and stumbled into coaching, actually. It wasn't a thing then, certainly for physicians. And coaching was a game changer. I'd had plenty of therapy, for the complexities in my family of origin. Therapy was great, but coaching was really almost like boulder shifting. It was like leapfrogging forward. Things that I thought I would go to my grave with, all of a sudden, were just not there anymore. And I think my son would say, and many of my family and friends would say, you really changed after coaching, Gail. You became happier. You laughed more. You seemed to enjoy things more. You seemed to be able to be more present. You seemed more at peace with yourself. So that's when I decided to pivot and become a coach expressly for physicians and physician leaders.
I love that. I love that so much. It's fascinating, isn't it? How on the previous podcast episodes, but also you and I have coached a lot of physicians. There is a very common pattern of, you could call it self-sabotaging behavior, that is seen in high achieving people, where they are pushing themselves constantly, kind of chasing the next thing, the next promotion. I'll be happy when I get to this point. And it's so common to hear about people in the medical profession sacrificing their health and their happiness. And I love what you're doing, because I think you are teaching people that it doesn't have to be that way. It doesn't have to be one or the other, like career success or health and happiness. You can have both.
Mm-hmm.
Yeah.
Yes, I wish we had really learned that in our training, but we learned a somewhat fixed way of being. And in my most recent book, Mindful MD, the first part of the book, which is the small part of the book, is called The Roots of Burnout.
Yeah.
It gets into some of what you're talking about, because so much of our training is on what we're not doing well, deficit-based training as opposed to strength-based training. We learn to be very critical of ourselves. We learn kind of a fear-based approach, such that we then feel like we have to prove ourselves.
Yes.
And obviously, so much of healthcare burnout is due to the corporate structure of medicine, the demands of the electronic health record, the haggling with insurance companies, et cetera, et cetera, et cetera. And yet, what I talk about in the Mindful MD book is that there are also some patterns that we learn in our training that actually set us up and then fuel physician burnout. Yeah. And once we begin to recognize them with mindful awareness, we realize that we can actually intervene with them. Yeah. And that's really what I hope for everyone working in healthcare.
Absolutely. I sometimes talk about, I call it my linen closet episode. I had an episode of hiding in a linen closet for 4 hours on a weekend shift. And I look back on it now, and I had no tools at all to cope with what I was going through. And, the only thing I could think of was to walk away from, that current rotation, and it would have meant setting my career back, etc. And I had heard of meditation at that stage, but it was hippy dippy, and I grew up with hippie parents, and I'd heard about mindfulness practice, but when I felt that when I committed to a career in medicine, that I had to like turn my back on that hippy dippy stuff.
Right.
And so I think, back then, and I'm showing my age here, that was 28 years ago that I experienced my worst episode of burnout. I just had no tools whatsoever, and nobody talked about it. It was seen as a sign of weakness to be struggling. And
yes,
it's really good to hear that things have, things are changing, and they have come a long way. And there's people like you out there working, offering resources to physicians and normalizing this and giving them the tools to get a way out of it. So I love it. I love all of what you're doing so much.
Well, the part meaning that we can't show weakness. We're the captain of the team, the all-knowing paragon. We always have the answer, even in the beginning phases of a global pandemic when there were no answers. And that can leave us feeling like there's something wrong with us if we don't know the encyclopedic, differential diagnosis or the most up-to-date treatment, et cetera.
Yes.
And we have to help our peers move on from that and develop kindness toward ourselves. We're human beings. We're fallible. We're vulnerable, just like all the patients we take care of. And when we realize that, we soften a little bit. We become more flexible. And what I've seen is that we can really steer ourselves. It's one of the factors that helps steer ourselves out of a life of burnout and into a life of really being satisfied with our careers, as imperfect and as challenged as they are by the corporate and dysfunctional structure that we find ourselves in, certainly in the U.S.
Yes, absolutely. So tell us a little bit more about, I've read your book, and it is wonderful. So many incredible resources. And I love that you begin by explaining it. I think, we medical professionals, we need to understand things before we can start to solve them. So I love that you kind of include that in the book. But tell us a little bit, and I'll remind everybody of the title again. It's Mindful MD, 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. So I'm curious, Dr. Gail, what led you to write this specific book?
Well, let me start by saying that your listeners can download a free chapter at gailgazelle.com/mindfulmd, so they can get a taste for themselves about what this book is about. And none of the 6 ways are sitting and meditating in time that busy clinicians and others in healthcare don't have. So I want to be very clear about that. And what led me to write the book is that I've had the pleasure and the privilege of coaching really hundreds upon hundreds of physicians and physician leaders. And I've seen a lot of similar patterns. Of course, we are all unique, and we all have unique parts of our stories and our existences. At the same time, there's a mindset that's cultivated in our training that can really trip us up. It's a wonderful mindset. It's the problem solving, the fix it, the being there for others, self-sacrifice, etc. But the dark underbelly is that we don't learn how to take care of ourselves. We don't learn how to work with our own patterns of emotional reactivity. And we definitely don't learn how to maximize the instrument that we all use in all of our waking hours. Guess what? This one, between the 2 human ears. And that's really what mindfulness is all about. I think when people hear mindfulness, they think hippy dippy. They think monks sitting on, the mountainside meditating for years and years. All of that might be true, but really it's a way of training our minds to focus where we want to focus, to sift through all of the unhelpful thoughts and stories and fears and worries and accusations and ruminations, etc., that the human mind tends to be populated with, and how to train the mind to focus on the helpful thoughts, stories, narratives, etc., the ones that are resourceful to us, the ones that help us with the challenges that we face. So my book is full of vignettes from my coaching practice, real-life vignettes of real-life docs who've themselves thought mindfulness was some kind of weird, thing, haven't necessarily started meditating, but have built the skills to actually be the master of their minds rather than the captive. And I've seen that be a game changer. I've seen how no matter how much external autonomy is wrested from this corporate medicine machine that we all live in, certainly in the US and in many other countries, we can still have the autonomy over ourselves.
Yes.
The autonomy over how we respond to the challenges and the difficulties in healthcare and in our lives as a whole. So that's what the book is about. And it's a very pragmatic guide that I think many of your listeners will find enormously helpful.
Yeah. And I love that you also sprinkle in a lot of stories as well. I'm a huge believer that, you know, even for highly scientific people, you know, people with a data-oriented scientific mind, storytelling is so incredibly powerful. It activates a different part of our brain that makes us kind of realize, oh, this could be me as well. And I think, you know, it's brilliant to include that in the book as well. And I think it also helps people see the common humanity of it. And to, you know, like you say, I think a lot of doctors who are struggling often think it's just them. And to know that, you know, I mean, you and I, Dr. Gail, you and I both know that almost everybody's struggling. Everybody, you know, everybody has their suffering. Everybody has their struggle. And, you know, to hear those stories of how other people kind of realized that they were in a suffering state that they didn't have to stay in is very empowering. So I love that balance that you had in the book of story and then very practical, you know, easy to implement advice. Are you tired of drowning in medical licensing paperwork? At Blue Shift Medical Licensing, their goal is to make your life easier. Let their expert team handle everything from paperwork to tracking renewals. You can relax knowing your licensing is in the hands of certified professionals. And here's the best part. Mention this podcast, Mindful Medics, for a 5% discount. With Blue Shift, licensing has never been simpler. Find them at blueshiftlicensing.com. That's blue, SHIFT licensing.com. So, and thank you so much for offering the free chapter, but would you be willing to give us a sneak peek into some of the key concepts, or to share like a strategy that people could implement today?
Yeah. Well, maybe I can just briefly go through some of the 6 ways that I have seen mindfulness strategies restore autonomy and cure burnout. The first is recognizing that we are not our thoughts. So the mind is busy producing tens of thousands of thoughts a day. And we start believing all of those thoughts and not questioning them. In fact, thoughts are simply transient mental events because of the negativity bias that is really part and parcel. It's hardwired into the human mind and brain. Many of those thoughts are negative judgments about ourselves, about our practice, about our patients, about our loved ones, about our planet, et cetera, et cetera, et cetera. And so we can begin to distance ourselves from our own thoughts and recognize that they don't define us. And in fact, they are different than what we are actually experiencing. So I share quite a few vignettes in the book. So I'll start with a vignette there. And I talk about a surgeon. I call him Brian, a very accomplished thoracic surgeon, you know, top of his game, very well esteemed. And he got some difficult feedback that he was seen as abrupt, rude, condescending, discourteous with the nursing staff. And when he first got that feedback, he just didn't take it very seriously. What do they know? What do I even care what the nurses think? I'm contributing so much to my hospital. What does it matter if the nurses think this, that, or the other thing about me? And it was really interesting because Brian, despite some of his flaws, and many surgeons learn a certain way of being in the world, he was really eager to learn about himself. And I charged him with spending 2 weeks becoming the observer of his own mind. So in other words, I encouraged him, Brian, just pay attention to your thoughts. See what's going on in your own mind. And he was like, okay, no big deal. I'll do that. Well, within 3 days, he actually called me. He didn't wait 2 weeks. And he said, Gail, it's like a crazy town up there. I had no idea there were so many thoughts. And I had no idea as well how negative all of my thoughts were, how I was putting down people mentally, discrediting them, thinking to my mind that they didn't know anything about anything. Once Brian realized that's mindful awareness. What is my own mind up to? It was a game changer for him because he realized that those thoughts really weren't helping him. They were contributing to how people viewed him in a negative way. Yeah. And he was a wonderful guy, like many of us who go into healthcare. He wanted to help other people. He just didn't know how to get out of his own way, so to speak. But with that mindful awareness, he gained autonomy. He realized he had a choice about which thoughts he paid attention to and which ones he just let by, very much like the clouds that go by in the open sky. Yeah. So that's just one brief example of how mindfulness can increase our autonomy and can actually free us to show up in a very different way in what is only can be described as a broken, dysfunctional healthcare system. No. So that's the first way. The second way is stepping out of mental stories. And those stories are really the conglomeration of the thoughts that we have. And I share a vignette there as well. I'll jump ahead to what I call the fifth way that mindfulness can restore autonomy. So I won't give them all away. It has to do with working with what is. And what do I mean by that? Well, many of us in healthcare have a little bit of a fantasy. Well, why don't we just go back to no electronic health record? Mm-hmm. Life was good then. Life was different, and I could be with patients and I could spend time. And we can have these ideas about if something outside of me changes, then I'll be happy and satisfied in my career. I call this the I'll be happy when disease or malady. And just to share that, for your listeners, let's say you're a physician listening to the show or a trainee. Maybe you're in high school and you think you want to go into healthcare. You want to become an NP, a technician, a doc, whatever it is. You want to get into the right college and you think to yourself, well, I'll be happy when I get into the right college. Then you're in college and, you want to get into professional training. I'll be really happy when I get into med school or, med tech school or NP school, whatever it is. Well, med school isn't exactly a walk in the park. You may not be happy. There's a lot of depression and anxiety amongst med students. But you're in med school and you start thinking, well, I'll be happy when I match into the right residency. Well, residency is not exactly easy. It's very stressful. Then the kicker is you're a resident and you're thinking, I'll be happy once I'm an attending. Yeah. And we have a lot of unhappiness, a lot of distress amongst attending physicians. So that's what I'm talking about. How do we claim happiness today? How do we tell ourselves, well, only if this thing changes can I be happy in my career? Because that means that we're really handing over our happiness to a dysfunctional system. And if your listeners take nothing else from me and from the Mindful MD book, it's that you don't have to hand over your happiness and career satisfaction to anything outside of yourself. You really don't, unless you choose to do so.
Yeah, I love that. When you were talking, I was reminded of I'm sure you come across it, Dr. Gail, but our listeners may not have, of the Bronnie Ware book, 5 Regrets of the Dying.
Yes.
One of them always, it breaks my heart a little bit, that I realized that I had the power to be happy more of my life. And that's what you're talking about. What a terrible time to discover that when you're on your deathbed, when you cannot change it. And when we stop and be more present and we practice gratitude and we look for the good things, we can experience the happiness today, like you say, and then hopefully avoid that regret of, I wish I'd been happier more of the time. It's just such a sad thing to regret, in my opinion.
Sad. And for all of us in healthcare who've worked so hard to get where we are in our careers and have so much capacity of caring and compassion for others, we just to have that kind of happiness within ourselves, that centeredness. And It's not really a platitude. It's the truth that we can find it. It takes some work. It takes some retraining of our own minds. And yet what I've seen again in hundreds upon hundreds of physicians is that it is possible.
I love that. Thank you so much for sharing that. Wonderful. So you've given us a great taster of the book, and I hope everybody goes and at least checks out the chapter and also buys the book. So I have a second last question for you. So based on your career, both in medicine and in coaching, hundreds of physicians, what are your top 3 pieces of advice for everybody on how to stay healthy and live your best life?
Well, I'll try to narrow it down to 3, Leonora.
You're cheating.
Yeah. First is get to know the workings of your own mind. Recognize that you are not your thoughts. It's a way that you can have so much freedom. And once you gain that mastery, it's a skill set that will help you in every aspect of your life and career. So that's 1.
Yeah.
2, pause during the day and take your own emotional temperature. Sometimes we can be so activated, angry about feeling like a patient is entitled, or angry that we have to spend so much time on the care and feeding of the electronic health record. And those emotions are costly to us. They dissipate our precious energies, and no one in healthcare has an extra reserve of energy. We're all, running kind of with full capacity. So if you can pause and take your emotional temperature, you begin to have more autonomy over your own emotional realm. You can slow yourself down. So that's the second. And then the third is be kind to yourself. It's hard working in healthcare, particularly since the pandemic, but even before that, it's demanding. The pressures are really never ending. The ever full inbox, all of the things you have to keep up on in this era of Dr. Google. So see if you can be kind to yourself along the way, just as you're very, very kind and compassionate to those under your care.
I love that. Thank you. Thank you for sharing those 3 pearls of wisdom. So lastly, we've talked about your book. Is there anything else that you're working on right now that you'd like our audience to know about?
Well, I will say that I and my team of physician coaches offer free consultations. If you're struggling in your career with burnout, or you want to get a promotion, you want to become a medical leader, you don't know how to manage conflicts, we offer free consultations. So you can go to my site, gailgazelle.com, and you can click there, and we're happy to help. We're here to help. So I'll say that in closing.
I love that. Well, thank you so much for joining me today, Dr. Gail Gazelle. It has been really wonderful. I know we could probably talk for hours and go into much more detail, but it has been absolutely wonderful today. So thank you again.
Thank you. Total pleasure.
And thank you all for tuning in today to the Mindful Medics show. And I urge you all to go out and find ways to be happy, healthy, and lead a full, thriving, abundant life. Bye-bye for now.